Vaccines for children and programs aimed at maternal and child health have dramatically reduced deaths among young children. But what about adolescents? The World Health Organization says their health is being neglected.
When you look at adolescents, and by that I mean the age group 10 to 19, we're finding that 1.2 million die each year. That's 3,000 deaths a day. That's, 10 jumbo jets.
Here, a family mourns the death of a 14-year-old girl. A WHO study finds most of the adolescents' deaths could be avoided. The report says more than 2/3 of the deaths occur in sub-Saharan Africa and Southeast Asia. This is a funeral of a child bride in Afghanistan. Of all deaths, traffic injuries top the list. Most kids are struck by a car while walking or riding a bicycle.
In India, for example, there are 90,000 deaths on the roads each year, and many of those are adolescents and children.
The causes of death differ by gender, age, and region. Boys between the ages of 15 and 19 are more likely to die from traffic injuries than girls or younger boys. Girls are more likely to die in childbirth. Their bodies are not ready to have babies. This play in Kyrgyzstan is meant to discourage the practice of child marriage. Girls between 10 and 14 are at risk from respiratory infections like pneumonia that they get breathing fumes from cooking fuels. Teens who abuse alcohol or drugs, or those with mental health issues, often cannot get the care they need to save their lives. The WHO wants governments and health agencies to develop plans to improve the health of adolescents.
Governments have got to invest in young people. I mean, what's the country's richest asset? It's their young people. It's their children, actually, because they're the future.
Governments could create and enforce speed limits and make using seatbelts mandatory. Health agencies could encourage adolescents to develop healthy lifestyles.
The roots of diabetes, of heart attacks, of strokes, of lung cancer, the root of that lies in the adolescent years, how adolescents approach nutrition and diet and exercise, and whether they start to smoke or not, or abuse other substances.
Improving the physical, mental, and sexual health of adolescents could result in significant economic returns, according to a study published in The Lancet in April. The study reports that an investment of $4.60 per person per year would yield more than 10 times as much in benefits to society. For VOA correspondent Carol Pearson, I'm Steve Baragona, VOA News.